Sir, madam, you are the machinery behind making everything possible for us as citizens, and it includes working on the never before seen situation like the pandemic.
Great word on space to grow and what we are up to. We're a social impact consulting firm, and our vision is to create collaborative solutions with complex social problems for complex social problems. We closely work with nonprofits, CBOs to enable them to accelerate their growth, through overall program management and other services like fundraising, research, advisory on technical thematics. One important area to achieve all this is to engage other key stakeholders like state and local governments and administrative bodies. And this particular discussion is pivotal to that effort.
It's absolutely exciting to have you all, as a eminent speakers in the panel. I just wanted to start off by saying one thing that one thing that I've learned in the development sector for years is that if you have a vision and if you want to do something, and you will be able to realize, and I think that's what you all do at the district level as behind the scene. And I think for us, this panel discussion is also like that. We really wanted that we do like a study, but then we didn't want to leave a study like a study. It's not like a 10-page document. We really wanted to make sure that that 10-page document, which has the voices of the community, reaches out to nonprofits, reaches out to civil society, reaches out to funders, and reaches out to the administration.
Regarding the pandemic, I would like to say, as an administrator, as an IS officer, or all the administrators who are working on the field, we are generally used to and are, you can call it, professional in handling pandemics, be it floods, be it famine, be it earthquake, etc. But this pandemic was totally different in the only one way that I can see is the vulnerability that it carries with the soldiers. So that was the biggest challenge for all of us. In fact, in the first wave itself, I could realize how the ANMs, how the hospital ward boys, how the doctors used to run away, used to resign the moment we posted them in COVID wards, because the scare was so high, the fear was so high that people used to even resign from the jobs. When the hotels refused to give us their buildings, I started Googling up what are the solutions, what can be the next thing that we can do to give a small relief, even if it is possible, to these people. So I came up with this phone booth sample collection device, which was there in a couple of countries that time. Korea and Germany was already using it. So I designed it in-house in my own courtyard, and then it got replicated, I think, in all over the country. So DD National also covered it. After a couple of days, again, when there was a COVID ward, there were patients inside. The people were scared to get in. That we had a bot kind of thing. We called it co-bot, which delivered food, water, medicine, and with facility of two-way communication and two-way video feed, where you can literally do telemedicine in the wards, and the number of people who are getting inside the wards got reduced by 80 to 90%. So that also helped us a lot in tackling, or you can say in reducing the fear of the people who were posted in COVID wards. More about treating the people, because it was severe, it was giving us less time, it was more scarier. So it was scarier because of the deadliness. So we had a lot of other challenges. So we came up with a IRCTC kind of website called amritvahini.in, in which one can go and book a bed in the hospitals. There were portals like this all over the country, but booking a bed was one of its kind in Jharkhand, which I implemented as OSD Health. I was also part of Oxygen Task Force. There also we made a panel kind of thing, obviously replicated from Ernakulam Smart City Room. That also I got implemented in Jharkhand. So these were a couple of innovations. Others were smaller ones, but these maybe have not solved the issue, but definitely reduced the scare that was there, definitely reduced the effort that was there, and also helped us in controlling the panic apart from pandemic. I would say something that is so simple, not something that is so easy to replicate. doesn't need anything other than willpower. So when I did this phone booth sample collection device or note sanitization machine or a disinfected chamber or this cobot thing, so everyone was like, it PM get a trademark done or get a this patented and all that. But I had this thing, this is just a jugaad kind of thing, and we don't need to do that in the times of pandemic. So what we did is we just formed an SOP of all these devices, and this SOP was sent to government of Jharkhand, and then they sent it to other states also. In fact, I got a call from Niti also to give me the SOP in terms of the size, the shape, the parts being used. There is a technology park called APMTJ, Andhra Pradesh
Yes.
Medical Technology Park in Andhra Pradesh. So I got a call from CEO of APMTJ also. They also got the SOP and they got it replicated. Reliance Foundation got the SOP from me. Rajasthan government got an SOP from me. So it was quite easy to replicate. So I would say there is nothing else required other than willpower if somebody wants to do it. It's just a simple thing to do.
Like sir before me said that first and second wave, that they were very different, both in terms of impact and also the kind of requirement that was expected out of us. So in first wave, our the main issue which we had to tackle was the fear among the communities and enforcement of lockdown. While in the second one, the main focus has been on vaccination. So during the first wave, when everything closed down and there was no movement literally at all, so at that time in the month of July, August, situation came when students had no classes or any education exposure for past couple of months. And that is when we came up with this idea of giving a rather clarion call to all the volunteers across metros, because what we got the feedback from our colleagues in big cities were that many of the people or graduates, postgraduates, they are at home and they want to serve the people who are actually suffering or who need their help. In the health sector, what we saw is that when COVID took over, everything else had taken a backseat. So what used to happen is that the immunization percentage suddenly dropped. We had an immunization percentage of 84%, and during the peak COVID, it had dropped to 50 to 60%. So we had to work a lot on that. We gradually started building up on the losses which had, and after the end of the year, we were able to even exceed the previous year's target of 84%, and we reached 91% of immunization cover. Also for deliveries and all, we knew that now hospitals are being occupied by COVID patients, so we need dedicated delivery areas. So that sanitization was done, and also we started IVR services through which a dedicated helpline was provided and ambulances were kept on standby, so that any woman who wants to get delivered in advance, they can actually book their time slots, and through that IVR service, they are able to come to the hospital using the government ambulance. We also knew that OPD services were not being carried out. So with a startup from IIT Kanpur, we started Arogyam clinics. These were basically telemedicine clinics in which again we used the help of volunteers, doctors basically from across the country. Because as you know, in COVID, some specializations, especially emergency medicine, pulmonary medicine, they are of great demand, while others, like dermatology or maybe ENT, so they are able to spare some time. So we used that and we were able to engage a couple of doctors who have been carrying out clinics even now from the past 1 year. They have been doing that. So that was one thing. And when the second wave came, then of course there was a lot of fear with regards to vaccination, and also there were a lot of misinformation which was going on. So what we used to do is that initially we first all of us volunteered and we started using social media to showcase that all the government officers took vaccine. Once that was done, what we did is that we brought forward religious leaders, because religion is a very powerful force and it can be used for good. So what we did is that all of them, they actually live streamed their vaccinations, and that those videos were circulated in social media. So that actually bust a lot of myths surrounding vaccination, and many people, despite beliefs in the mainstream that that in Northeast many people were very fearful of vaccination. In my district, for example, 80% of the eligible population, we were able to give first dose of vaccine because of that. So that was very helpful. And we also had a competition between the medical officers and the vaccination teams.
There are volunteers, if there are civil societies who want to work around this issue to just break the perception around vaccination. Right now, I know like everybody has at least started believing that vaccination is really important and they have to go and get it done. I mean, it's really moved to a certain stage, but still there are communities who face this. So how can you make all the other districts, the district that you actually manage? What is it that mantra that you would want to share with all of us?
There have been a lot of misinformation even within the local communities, and there are some nuisance elements also which we always find. So it is always important to first go at a village level, because every village has its own issues. So once you are able to micro plan that according to the local village issues, because some village might have terrain issues, some village might have a misconception that COVID is not a disease, and that is actually cases which we have encountered. Some villages might say that vaccination might cause some other problems to you. So there are different issues in every village, and if you are able to ask your Asha workers and Anganwadis that what is the particular issue in the village, that why people are not coming forward, then definitely over a period of time, you give it 5 to 10 days, you send your administrative officer, you send your panchayat people, and you have to work on the villagers gradually. And definitely we have seen that after a couple of days, people who were actually totally resistant to the idea, they came on board.
I think another thing that Ankita, we're very keen to really understand from you would be that the reports kept talking about when we have spoken to people is that, home isolation as a protocol within the COVID has been a very important protocol to follow. But at the same time, I know that, we had volunteers who actually did this, and some of the volunteers were really young volunteers from schools who actually helped us with this particular project. And for them also, it was like a eye-opener that, in the rural India, when you have to talk about home isolation, they don't even have enough space to actually cover a household. So home isolation was becoming like a huge challenge, even when they wanted to, and it's an extremely important protocol to follow. So this includes both semi-urban and urban communities. 83% of them said that, we want to follow it, but we don't have means to follow it. So, and you have, Ankita, done some commendable work around initiating COVID centers in Delhi and have experience in this particular problem. And you've actually led quite a lot of work during this phase of the pandemic. What would you, do, or what? One, please share your experience. And the second thing is about how would you want to scale up those initiatives that you've started in Delhi? What is your call that you want to share with philanthropies funders across the country? So just over to you, Ankita. I know that's quite a lot of questions, but I know you can handle that. Thank you so much.
People, they were not ready to acknowledge the disease at all. They were like, this is the disease of the riches, because that's how this thing started. So now coming back to your question regarding home isolation and setting up of COVID care centers. So Delhi was, fortunate enough to have a lot of community workers, NGOs, philanthropists working in this direction. And we've got immense support from them. So I don't know if that can be replicated, but I'm sure there are many organizations who are ready to work. It's just that we have to show some support to them. So like we started Sardar Patel COVID Care Center over here, and which was a 10,000 bedded facility. Before that, we had started Tera Pant Bhavan. So what had happened is that a lot of people, we just had to give a call, and as Devansh sir also mentioned, that you just have to sometimes give that call, and there would be thousands of people who would just be ready to get associated with the administration and help us go through it. So I would suggest for village areas as well, we can take up the panchayat ghars and the community centers which are there in the village areas, and probably ask the people who are interested in funding these places. And even for doctors, I would say we've had in Delhi Doctors for You, and those guys were really helpful to us. And to tell you the truth, district administration hardly had to spend a penny.
Thank you so much. And I think, when Anuj started, he said this, we might come up with like a brilliant idea to do something. And I think when many minds and brains are better than just one, and I think we always believe as an organization that we are not just the one, we have to collaborate and we have to come together to design solutions. Thank you so much for giving that opportunity to us.